Hello guys, welcome to my YouTube channel. This is my second video and I'm going to talk about focused respiratory health history and physical assessment. So before you begin, don't forget to make a therapeutic interaction with the patient. You can describe your position, who you are, and what you are going to do. You can introduce yourself and then say that you are going to assess the breathing by looking, listening, and gently tapping the patient's chest. And you can also reassure that it won't be painful and let them know if they feel uncomfortable. And the other thing, the most important, is the patient privacy. Just close the curtains or door before proceeding and get the patient's consent and ensure the patient is right, and ask them their name and date of birth. Check the ID band. And another most important thing is to ask if they have any pain. Make sure they are in comfortable position and ensure you give pain relief if they complain of any pain before you start the procedure. Let's talk about the indications of respiratory health history and physical assessment. The first one is dyspnea or shortness of breath, and also check if the patient has use of accessory muscles, and also history of respiratory diseases like asthma, COPD, and pneumonia. The other indication is wheeze or chest pain, and for the chest pain, it could be either sharp, stabbing, or burning sensation. It is also called pleuritic in the medical term. And similarly, the other indication is low oxygen saturation and cough, which can be dry or productive. So for obtaining the respiratory health history of the patient, you have to ask a couple of questions, like ask if they had history of shortness of breath and also when did it start. Similarly, ask the question if they had any productive cough before and what was the color. And the third one is chest pain. Did they had history of chest pain? Was it pleuritic, which means was it sharp, stabbing, or burning sensation? Similarly, ask if they had wheeze or chest tightness. And the other one is absolutely, this is the most important, I think, if they have any history of smoking or vaping. And the other one is past respiratory conditions like asthma, COPD, or pneumonia. And you should ask if they use any oxygen at home, inhalers, or any medication. And the other most important thing you can ask is if they had family history of lung disease. Now we need to gather equipment. We need to gather a stethoscope, pulse oximeter, and watch on the other hand. And don't forget the 5 moments of hand hygiene before you start. Let's talk about inspection. So you need to inspect the general appearance of the patient, whether they look distressed or cyanosis. Check the level of consciousness, whether they are alert or if they know the time or where they are at the moment. Check if they are using accessory muscle. Check if they are in the tripod position, which means constantly leaning forward and not being able to lie flat. Check the effort of breathing. Look for the bluish tint, as I explained before, and check the pallor if the skin looks pale or gray. And most important, check the chest symmetry. It means the chest look and move like a matching pair, also known as thoracic symmetry. Check the respiratory rate. Also, be mindful of the depth and pattern of it. And another, again, check the signs of respiratory distress, also known as intercostal retractions or supraclavicular retractions, in which skin sinks in above the collarbone during inhalation. Let's move into palpation and percussion. Look at the chest expansion, both interior and posterior. Compare both sides. Check for tenderness. You are not sure what is chest percussion and why do we do it, here are some information I have gathered for you. You can pause the video and look at it. While auscultating, listen for crackles, wheeze, or reduced air entry. If there is a sign of reduced air entry, it is a medical emergency and you need to act promptly. Now, don't forget the equipment care. Clean the stethoscope, dispose of the single-use items appropriately, and return reusable items. Documentation, which is the final and the most important part of any assessment. So document clearly what is the respiratory rate, oxygen saturation, how was the breath sounds, and if you see any abnormalities, and if you see any symptoms. Thank you so much for listening and taking your time to listening to this video. Bye.